Hi everyone, this is Dr. Pasunuti Sumanth, consultant pediatrician. Video topic is febrile seizures, and many parents have been asking about this topic. So here is the detailed video answering almost all your queries. So watch the video till the end. A febrile seizure is a convulsion or fits in a child which is triggered by a fever. Now we'll have a look at what are the reasons for these febrile seizures. A temperature of 100.4 Fahrenheit or 38 degrees centigrade or above may cause febrile seizures in children. Many parents do believe this, that only high temperature will cause febrile seizures, but this is not true. Even a 100-degree fever will also cause seizures. So stop worrying about the temperature of the fever. A febrile seizure can be frightening for any parent or caregiver. Most of the time, a febrile seizure does not cause any harm. The child usually does not have any serious long-term health problem. These seizures occur more often in otherwise healthy children between the age groups of 6 months to 5 years, and among these, toddlers are the most commonly affected. Febrile seizures often run in families. Most of the times, we can see any one of the parents having this condition in their childhood. Most of the times, febrile seizures occur in the first 24 hours of an illness. It may not be occurring when the fever is highest. As I said before, a cold or simple viral illness may trigger a febrile seizure. Now we will see what are the symptoms of these febrile seizures. A febrile seizure may be as mild as the child's eyes rolling or limb stiffening. A simple febrile seizure usually stops by itself within a few seconds to 10 minutes. It is often followed by a brief period of drowsiness or confusion. Symptoms may include any of the following: sudden tightening of the muscles on both sides of a child's body. The muscle tightening may last for several seconds or longer. The child may cry or moan. If the child is standing, they will fall. The child may vomit or bite their tongue. Sometimes children do not breathe and may begin to turn blue. The child's body may then begin to jerk rhythmically, and the child will not respond to the parent's voice. Sometimes urine may be passed. A seizure lasting longer than 15 minutes is in just one part of the body or occurs again during the same illness is not a normal febrile seizure. In such cases, it is important to rule out other causes of a first-time seizure, especially meningitis. So, it is always ideal to consult your pediatrician when your child is having first episode of seizures. Now, we'll see what are the tests are needed in febrile seizures. With a typical febrile seizure, the examination usually is normal other than the symptoms of the illness causing the fever. Often the child will not need a full seizure workup, which includes an EEG, head CT scan, and a lumbar puncture. Further testing may be needed only if the child has these symptoms. If the child is younger than 9 months or older than 5 years, or has a brain, nerve, or developmental disorder, or the child had seizure only in one part of the body, had the seizure last longer than 15 minutes, or more than one febrile seizures in the first 24 hours, or has an abnormal finding when examined. Now we'll see the treatment part of these febrile seizures. Our aim of the treatment is to manage the underlying cause of these febrile seizures. The following measures help keep the child safe during a seizure. Do not hold down the child or try to stop the seizure movements by rubbing their hands, and do not leave the child alone. Lay the child on the ground in a safe area and clear the area of furniture or other sharp objects. Slide a blanket under the child if the floor is hard, and move the child only if they are in a dangerous location, and loosen the tight clothing, especially around the neck. If possible, open or remove clothes from the waist up. If the child vomits or if the saliva and mucus build up in the mouth, turn the child to the side or on the stomach. This is also important if it looks like the tongue is getting in the way of breathing. Do not force anything into the child's mouth to prevent the biting of tongue. This increases the risk for injury. If the febrile seizure lasts more than 5 to 10 minutes, call an ambulance and take the child to the emergency hospital. After the seizure, the most important step is to identify the cause of the fever. The focus is on bringing the fever down, and the doctor will advise what are the medicines to be given to reduce the fever. Follow instructions exactly on how much and how often to give your child the medicine. These medicines, however, do not reduce the chance of having febrile seizures in the future. Now, we'll see what is the prognosis of these febrile seizures. The first febrile seizure can be frightening for parents, most parents are afraid that their child will die or have brain damage. But remember, most children outgrow febrile seizures by age of 5, and few children have more than 3 febrile seizures in their lifetime. The number of febrile seizures is not related to the future risk for epilepsy, nothing but called as seizure disorder. Children who would develop epilepsy in future anyway will sometimes have their first seizures during fevers. These seizures most often do not appear like a typical febrile seizure. Now we will see the prevention steps for these febrile seizures. Because febrile seizures can be the first sign of illness, it is often not possible to prevent them. A febrile seizure does not mean that your child is not getting the proper care. Occasionally, your pediatrician will prescribe a medicine to prevent or treat febrile seizures that occur more than once. But however, no drug is completely effective in preventing these febrile seizures. So this is all about febrile seizures in children, and if you have any further queries, please do ask us in the comment section, and thanks for watching.